Sorry, we'll be starting in 5 minutes, please. Just give us some time to just put one or two things in place. Thank you, thank you. Sorry for the slight delay. Set. Okay. Okay. Good evening. Good evening. Please, could you put on your earpiece? Please, there's a earpiece. Yeah, put on your earpiece. Please wear your earpiece. Okay, okay. Okay, you can hear me without the earpiece. All right. Once again, good evening, ladies and gentlemen, and it is my pleasure to welcome each and every one of us to our side event taking place here at COP29 under the WHO Pavilion. And today, this is second in the series of our side events that we are hosting here in Baku. Yesterday, we had our first outing at the side event room 9. And today, we're having the second side event. And after today, as from Monday till Thursday, we're having our exhibition stand at booth 48. Today, the theme of our side event, as you can see, is mainstreaming climate change disaster risk into healthcare delivery. And we have a list of panels that will be addressing this issue. We have some on site and some online. So I'm going to start by introducing those who are on site, and then I will introduce those who are online. So it's going to be an interactive section because of the time, we have just 1 hour to go through our deliberations today. And so we also want to be very fast so that we can also give room for contributions from the floor. And so to begin with, let me introduce one of our partners of this event, and that is the Nigerian Maritime Administration Agency, all the way from Nigeria. And we have Kabiru Bello, who is an Assistant Director on Marine Environment Management Department. So, Mr. Bello, please, you can come and have your seat here, sir. And next on the list is not in no particular order. I also want to recognize a climate change activist, an expert in the field, somebody I've known for more than 20 years. We all started off in Nigeria, but right now she's working for them in Germany. And I want to introduce here to this podium Miss Unfccc George Emana. She is the 1 minute. Let me give you her particulars quickly. All right. Okay. She is the senior Beraterin in Future Camp Climate GmbH, all the way Climate Change Division from Germany. So, Dr. Unfccc George Emana, please, you come to. Can we just encourage them with a clap? Thank you very much. Thank you very much. Thank you very much. And also to join us at the podium is the special senior assistant to the governor of Delta State. Last year at COP 28, the Delta State government, one of the coastal states in Nigeria, known as the Niger Delta. Niger Delta is one area in Nigeria that you have a lot of massive oil exploration, and then you have environmental degradation as a result, and then it's also prone to a severe disaster risk. And so we had our event with them last year under the Delta State Oil Producing Development Area Commission. And today we are continuing with that same relationship. I have with me here the SSA, Senior Special Assistant to the Governor, and that is Honorable Rex Anioro. Please, you're needed on the platform. From those online, I would like to introduce a very special guest. This lady I want to introduce, she is a dean in the Department of Public Health Nursing. Sorry, in the Department of Public Health Nursing Faculty of Nursing and Allied Healthcare Sciences at the University of Abuja. And so please, if you can showcase Professor Khadijat Toyin Musa, she's online. Can you just show her online and let her just say hello to us? She's on online? She was online. She's off. All right, maybe we'll have her again. Is there anyone? Okay, she's back. All right, that's Professor Khadijat Musa. She'll be speaking to us shortly. So thank you, ma'am, for having you. And so, ladies and gentlemen, I want to begin this section with a brief remark. In 2009, that was at COP 15 in Copenhagen, there was just a single line in the UNFCCC working document about health. Nobody, as at 2009, was ready to link climate change with public health. As at COP 15, the WHO set up a group known as the Friends of Health. 27 NGOs joined, and Nurses Across the Borders was one of them. We began a campaign on trying to make climate change discussion topic, as we began the campaign of making health as the driver for the climate change discussion. And that campaign started and as at COP27 in Sharm el-Sheikh, the UNFCCC agreed to make health as a thematic issue in the climate change discussion. And following that, in 2023 at Dubai COP28, that was when we have, for the first time, we had the health ministers all over the world having what they call the Health Day at the UNFCCC COP. And today, you all agree with me that there's no gainsaying, and everyone has come to accept the fact that the only way by which you can measure any success in our climate change campaign is on its impact on your health and my health. And so, health will have to be a driver of the climate change discourse. So, those across the borders have been collaborating with the WHO in this effort, and that is why we are continuing in that same effort with our discussion today. And this is the Finance Corp trying to discuss on how they can finance mitigation, adaptation, and then one area that cannot be left has to do with the disasters that we're all enjoying. Within the last 10 months, this year has recorded one of the worst disasters in climate change. Is it the flood in Florida? Or is it the flood disaster in Nigeria that encompass a whole state in the northern part of Nigeria? So which is why today, for us to be able to make any success out of whatever campaign we are having, there is a need to mainstream climate change, disaster and risk into healthcare delivery. And that is why we're having this topic today. Disaster are first and foremost considered in terms of their human consequences. People's health is a key imperative for reducing disaster risk and building community resilience. The IUGO Framework for Action 2005-2015 recognizes health in the expected outcome, which was to be a substantial reduction of disaster losses in lives and the social, economic, and environmental assets of communities and countries. Effective implementation of risk management measures by all sectors will achieve improved health outcomes in terms of saving lives, reducing injury, illnesses and disability, and improving quality of life for people at risk. Health indicators measures the impact of disaster and the effectiveness of disaster risk management by all sectors. The impact of emergencies and disasters on individuals, families, communities, and countries, and the progress made on disaster risk management is often measured at first in terms of health, lives lost or saved, the number of people with injuries, illness from diseases, disability, and psychosocial effects, and the total number of people affected in general. Health is vital to the measurement of well-being, resilience, and development. Health facilities, especially hospitals, are critical assets for communities, including in response to emergencies, disasters, and other crises. Yet, hospitals and health workers are often among the major casualties of emergencies, meaning that health services cannot be provided to affected communities when they are most needed. The vast investment in health infrastructure can be lost when poorly constructed hospitals can absorb up to 70% of ministry budgets, critical to public health and are an important symbol of social well-being. Destruction or damage to a hospital may result in a loss of connectivity and trust in the local authorities, as well as exposing patients and health workers to further vulnerabilities. Acts of violence, including direct attacks, have increased the threats to the security of hospitals, workers, patients, and health services. Communities and countries need to take measures to ensure the safety, security and functionality of their health infrastructure. They should prioritize the protection of new and existing hospitals and other health facilities from identified hazards and ensure the physical integrity of buildings, equipment, and critical hospital systems. In addition, they should provide for the security and well-being of health workers and patients and ensure that hospitals are capable of continuing to function and provide life-saving services in immediate response to emergencies and in the aftermath. A safe hospital program is an essential component of emergency and disaster risk management for health. The IAGO framework for action makes reference to promoting the goal of hospitals safe, keeping hospitals safe from disaster by ensuring that all hospitals are built with a level of resilience that strengthens their capacity to remain functional in disaster situations and implementing mitigation measures to reinforce existing health facilities, particularly those providing primary health care. The World Health Assembly and WHO Regional Committee resolutions have been passed with member states pledging to make their hospitals safer. The scale of damage to health facilities ranges from a single critical hospital to many health facilities. For example, in September of 2009, floods caused the evacuation of patients and shut down critical services in Burkina Faso main hospital. National and local health systems that provide health services for millions of people have been affected by damage and destruction to thousands of health facilities in Gujarat, India 2001, in Indonesia's Northern Aceh province in 2004, Pakistan 2005, and Myanmar in 2008. More than 11,000 health facilities were damaged or destroyed by earthquake that struck China on May 12, 2008. 432 health facilities were damaged by Typhoon Haiyan in the Philippines, including Barangay health stations where you had 296 destroyed. So the total damages as at that time was estimated to be around USD $26 million. So ladies and gentlemen, tonight, to help us with this discussion as to how we can mainstream climate change, disaster risk in healthcare delivery, I want to start the discussion by calling on Dr. Unfccc Georgimana to just give us an highlight on COP29, which has been termed a finance COP. How can the outcomes from the COP create the enabling environment to foster private sector engagement, making climate solutions viable and profitable investment? Dr. Unfccc.
Thank you very much, Pastor Peter. Thank you very much. I listened to your speech and the graphic illustration of the cost of climate impact in terms of human health and in terms of the socio-economic cost. It's very graphic. In trying to answer that question, whether it is COP29 and talking about finance, I think it's important that we first of all agree amongst ourselves that it is quite crucial for us to raise the topic raise the topic of health and climate impact to a position or to a point that begins to make very sound advocacy value, and that's what you're doing. Finance can flow, and finance can be drawn, and finance can be crowded, where the right advocacy has been done around a theme or a topic. So if a topic remains in obscurity, finance won't flow. It will not flow. That answers that question. And let me also try to address the topic of today, which is mainstreaming climate change risk, disaster risk into healthcare delivery system. I see health as a physiological infrastructure, which means, or you can call it a biological infrastructure, which means that an unhealthy population, an unhealthy community is unable to progress and to prosper. And therefore, we don't need to be reminded of the importance of health in our society as we run it as a system. Now, for us to be able to address these issues of, I'm not a health professional, I'm a climate scientist and also a carbon market specialist. So I want to address the issue conceptually in terms of climate change and in terms of climate change, and try to draw a little bit of nexus in terms of the public health. Now, in terms of climate change, if you are asking that we need to bridge the capacity gaps, because that's what the title says. The title says bridging the capacity gaps between developed countries and developing countries in terms of mainstreaming, in terms of narrowing down the value, the thematic, the essence of climate disaster risk management into healthcare delivery. And it's going to be public healthcare delivery. We first of all have to accept that we are not, that we need, first of all, to see climate disaster in our communities as a real tragedy, as a real developmental problem. Now, I come from Nigeria like you, although I'm living and working in Germany. And you realize that sometimes when these floods and disasters and hazards happen, we tend to give it a connotation that is completely distracted and separated from the real cause, which is climate change. Some people, the indigenous communities tend to say it's spiritual. Some people tend to say it is because of this. So what I'm trying to drive at is that we need to raise a community of informed people that understand that when hazards and disasters happen, it has to do with climate variability in its carbon budget, in its radiation balances, and therefore the policymakers should be responsible to beginning to identify strategies and also build that community information capital that people are able, not just the communities themselves, but also the municipalities themselves and the district governments that are able to think around these issues as a very topical development issue. And when it is until it is being appreciated as a developmental issue that we will be able to be talking about attracting finance or making it into the world map or making it become a topic that can be mainstream into healthcare delivery system. So that's the point I want to draw your attention to. Thank you very much.
Thank you very much. Thank you very much. No, you can have it. Thank you very much, Dr. Osika. Now, online, we have Professor Khadija Toyi Musa. She's going to talk to us for the next 7 minutes on climate resilient healthcare, integrating disaster risk reduction into healthcare delivery. So can we have Professor Khadija Toyi Musa online, please? She's on. All right. I think she's having issues with her connectivity. Let's move on. Distinguished ladies and gentlemen, SDG 13 and 14 are climate actions and life below the water, respectively. Excessive increase in atmospheric temperature due to the effects of increased green gas emissions affects the health of the ocean, causing flooding, eutrophication, destruction of coastal communities, and biodiversity. When these disasters occur, who suffers the devastation? Humans, of course. So, why, or rather, why is the NIMASA and IMO and ICO, another international agency, concerned with the plan to reduce the green gas emission to net zero? And that is why our next speaker is Mr. Kabiru Bello, who will be talking to us on how do we incorporate the health component in the development of a national ship emission inventory as a way forward to achieving the net zero IMO call. Mr. Kabiru, sir.
Thank you very much, and good evening to everybody. Of course, I'm from NIMASA, and NIMASA is like IMO in Nigeria, and we all know the role of IMO. They are regulating the international shipping. and they have developed a lot of regulations in terms of greenhouse gas emission reductions. They are even developing the price mechanism for the greenhouse gas emission reduction all over the world. So we in Nigeria, we are state parties, and we are implementing whatever IMO has provided for greenhouse gas emission. Aside that, if I digress small out of what IMO has been doing, we as an agency in Nigeria, we have already incorporated healthcare delivery into our system as our national legislation. As a responsible agency, we are operating about 3 clinics, full-fledged clinics that are providing primary health care. We are also making referrals to a secondary care or tertiary care hospitals for the Nigerian seafarers. We certify their health fitness before they board into any ship in the country. That is our plug. So it's part of what we as an agency that we are doing. So, and we have a full-fledged department for accident and emergency, it's like a bureau under the agency. So it's all part of the healthcare integration that we as an agency we are doing. Then coming back or getting back to what IMO is doing or what we are doing in consistent with the IMO global ship rate for emission. Recently, 2021 IMO has 2023 they have amended the GHG strategy emissions for international shipping, and they are doing a lot of things in terms, though they have not yet amended. Even I just came out from one of the side events, and the IMO head of climate change action plan implementation, he was mentioning that there are about 2 amended instruments that are now on the pipeline for them to be, that is the London Convention and the carbon captured but for now they are like non-mandatory level. But by the time IMO finishes all the consultation with the member state, I'm sure it will come to a view. So I'm happy also to understand that UNFCCC has is trying to make the healthcare delivery to be one of the thematics area of discussion, which is a very, very key. Of course, the previous speaker said a cleaner nation must have a cleaner population. So healthcare delivery is very critical, not only to every sector. So I'm happy to understand that UNFCCC is integrating it into the thematics areas. So thank you very much, sir.
Thank you very much, sir. Sorry. Yes, I think to actually underscore what Mr. Bello said, Noise Across the Borders early this year was admitted into the National Technical Committee on Climate Change for NIMASA. And so that helps to even build the relationship and interaction that we're having, because they are also in support of the need to develop and build the capacity of their seafarers. Seafarers are the workers on the ship. And so you have a lot of sicknesses occurring during all this as a result of climatic changes. And so they underscore this, and that is why we are reaching out on this collaboration, and they want to take this collaboration further in terms of trying to build the capacity of healthcare professionals in playing their roles in mitigation and adaptation strategy. Going from there, the government cannot do it alone. The business cannot do it alone. We also need the people who are close to the community, and that is when you talk of the civil society. And so the civil society are those who takes the measures of whatever government is implementing to them. The civil society also acts as a mirror to the agencies of government and then to also the business community. And so today, talking on strengthening civil society engagement with government in combating climate change, I will have to introduce Honorable Rex Anioro to speak to us for the next 5 minutes on how to strengthen this civil society engagement. We are hold on, please. Professor Khadija is online, on and off. Okay, when she's online, don't let me know she's on. Is she on? Can we have her? No, sorry, because our network, let's ask if she's ready so we can have her, give her people in 7 minutes. She's going, okay, fine. All right, Honorable Rex, please, your 5 minutes begin now. Thank you.
All right, thank you very much. Once again, let me stand on the well-established protocol and again begin by thanking Pastor Peters Osawa Morogbo for this opportunity and for what he has been doing all over the years. Consistency in doing what you do is what brings changes and brings value to people. And the value that the people of the Niger Delta they are having today is because people stepped ahead to think for them. A great man said, if you don't think, you will sink and you will stink. And so when we have people like Pastor Peters Omorogbo thinking for a whole region, then it means that we will not stink and we will not sink. Another good man said, if you don't organize, you will agonize. And so we have a Pastor Peter Omorogbo who is leading the charge in the front lines for all of us in the Niger Delta of Nigeria. And that brings me to the issue of an uninformed society. When the people are uninformed, the society, the community is deformed. And therefore, you need people to be able to take information, relevant information for the now, for the season, to the people. Climate change is not a fluke, like I said yesterday. It is not a scam. It is a profound reality, a solid reality that is upon all of us. And if policy makers who win elections, and they win election because maybe they are able to provide bread to the hungry, do not understand what climate change is. Therefore, there's going to be a policy gap. It therefore means you must have people who understand what climate change is, what the trends are, to be able to help both the government and the governed to have an equilibrium in addressing these issues. And that's where civil society engagement becomes critical. People like Pastor Peters Omorogbo, and that's why I'm wearing his shirt. I say it every time. God bless Pastor Peters Omorogbo. They've been able to bridge that particular gap, helping to even build the capacity of civil society leaders like me, who is in government, because I'm a civil society leader in government, to be able to do the job. And so what do? When we come to COP, which again I say is not a jamboree, we build our capacity to go back there to deal with the issues of the people in the communities, in the rural areas. And that's why I want to thank the MD of the SOPADEC, Chief Francis Oshonogo, and the chairman, Chief John Nani of the SOPADEC in Delta State, for the partnership that they've built with nurses across the border, to be able to take these issues to the people in the oil-bearing communities, because that's where the issues are. They've been devastated, their livelihood has been upended by flood and then by diseases and this health situation. And so I want to thank also the governor of Delta State, His Excellency, Right Honorable Sheriff Francis Oborewori, who also is part of this partnership, who also ensured that the MOU was signed last year in Dubai. And we are saying that that partnership should continue, should be deepened, should increase, so that the people of Delta State that Pastor Peter Omorogbo is helping, we have the full benefit. I want to conclude by saying that until you cannot get financing to, like you said, for the good of your people, until you continue to build on what you already have. You must frame the issues. You must have a clear purpose. When purpose is not known, abuse is inevitable. So people must build on purpose, must be deliberate, must be intentional to deal with the issues that confront their people. And that is where we are. The civil society are in the front lines, working with nurses across the border to build their capacity and to deal with the issues that confront us all. Together, if we don't confront climate change, we all will be a disaster waiting to happen. Thank you very much.
Very much, Honorable Rex Anioro. Is Professor Kadidat back online? Is anybody online there? Nobody? All right. Is anybody? Okay, she's back.
Everyone.
All right.
Thank you very much. Good day, everyone.
Yes.
I am Khadija Toyin Musa, and this study was conducted by two of us, myself and Dr. Saeed Adekola, both of us of the Faculty of Nursing and Allied Sciences, University of Abuja, Nigeria. The title is Climate Resilient Healthcare, Integrating Disaster Risk Reduction into Healthcare Delivery System. We are motivated because of the recent disaster that have been recorded in Nigeria health sector, especially the one that happened in Maiduguri and Yola, which of course submerged the health industry, and then everybody could not really know what to do. I have a declaration to make, and I declare that nurses across the border, an NGO in special consultation status with the UN, gave us the leverage to be part of this congregation. I sincerely want to thank Pastor for the opportunity he has given the Center for Health System Support and Development, Faculty of Nursing and Allied Sciences, University of Abuja, to be part of this conference. The two objectives drove this study, and the number one objective is that to assess perception of disaster preparedness among some selected care workers in climate-related shocks area in Nigeria. And two, to find out factors responsible for challenges in implementing disaster risk reduction in healthcare in Nigeria. And the last objective is to propose actionable recommendations for building climate resilience healthcare based on the outcome of this study. I have just 7 minutes to speak, and I'm going to just give a synopsis of the study. Climate resilience in healthcare means the ability of healthcare facilities to maintain functionality in the face of climate-related shocks like extreme weather and flood, as it is happening now in Nigeria. Whereas disaster risk reduction refers to systematic efforts to analyze and reduce disaster risks through structural and non-structural means. So our focus is to actually find out whether Nigerian health sector is able to imbibe all of these. In recent years, Nigeria has experienced increasingly severe flooding events that have heavily impacted healthcare facilities, particularly in flood-prone states. And again, I want to talk about the Maiduguri event and that of Yola. Over 2,000 homes were damaged, and essential infrastructures, including healthcare centers, equipment, were affected, and then straining medical response capacity and access to healthcare services in affected areas, because some of these areas that were affected could not offer, the healthcare delivery to the providers. In 2004, that we are alone, there was heavy flooding that further damaged infrastructure in states like Borno, Adamawa, and Yobe, where essential public services, including healthcare facilities, were badly affected. The United Nations Office for the Coordination of Human Affairs reported that 65 healthcare centers in Yobe alone were affected by recent floods. And this is huge, underscoring the urgent need for robust disaster resilience infrastructure to mitigate this impact. The statement of problem, Nigeria faces a growing risk. Please, I want to find out if people can hear my voice. Am I audible, please?
Hear you.
Okay, thank you. Nigeria faces a growing risk of climate-related disaster, including flooding, heat waves, and extreme weather events, as we have recorded in 2024. These events increasingly disrupt healthcare delivery, damage infrastructure, and strain limited resources. But despite the risk, many healthcare facilities in Nigeria are inadequately equipped to withstand climate-induced disaster. And so this is worrisome, and this is why we had to do this study. The method, we involved qualitative methodology, and we did online focus discussion because it's convenient, it's affordable, and then we were able to pull people together. It's also cost-effective. Again, because of the flexibility of the virtual session. So we had video conferencing using virtual reality to conduct our focus group on the focus group platform. And we prepare, our participants. We saw their consent, and then they gave us their consent to participate. Again, we tested the technology because logistics sometimes may disrupt the connectivity. So we were able to ensure that we could do this. In all, we conducted 24 focus group discussions among healthcare workers in some selected hospitals that are prone to flood and disaster in Nigeria. our findings. This is the focus group process. We introduced the concept to the participant. There was open-ended questions, and then there was discussion and interaction section. There was also note-taking for evidence-based. We recorded the session, and there was debriefing. And I need to state that some of the driving things that we asked were two. We look at the perception of disaster preparedness. We also found out factors that can be responsible for challenges in implementing disaster reduction, risk reduction in healthcare in Nigeria. Our findings are as follows. Number one, based on the thematic analysis, we analyzed the qualitative data gathered from the 24 FGDs and interviews using thematic analysis to identify recurring themes that are related to DRR practices, the challenges and opportunities within Nigeria health care system in those selected facilities. Theme 1 on perception of disaster. So I'm on results. Number 1, awareness and knowledge gaps. Participants expressed varied levels of understanding regarding disaster reduction strategies. Many healthcare providers indicated limited awareness and insufficient training on disaster preparedness. This is very worrisome. Number 2, recognition of climate change impact itself. Our interviewees highlighted awareness of climate events such as floods, heat waves, droughts, disrupting healthcare services, with a general recognition that climate resilience is, of course, becoming very essential. Positive views on DRR benefits. Many participants agreed on the benefits of DRR in maintaining healthcare continuity, including reducing patient risk, enhancing emergency response, and protecting infrastructure. For Team 2, which focus on challenges in implementing the DRR in healthcare, these are the findings. Number 1, that's Team 2A, we look at the resource constraints. Both FGDs and interviews reveal concern about limited resources, for
Professor,
example,
you have 3 minutes.
financial, human, and material,
Professor,
that make it very difficult to implement effective DRR measures, such as emergency stockpiles, backup powers, and so on. Then policy and governance barriers. Healthcare providers also express frustration over policy inconsistency and lack of supportive regulations prioritizing DRR in Nigeria, especially in integration in the healthcare. So this includes unclear responsibilities between government agencies and a lack of strong implementation of disaster response framework as measures by them. And of course, this is where we need to do a lot, because the disaster, honestly, the impact is huge. And I give you a typical example of what happened in Maiduguri. All equipment that they use for cancer treatment, radiology, and other management algorithms were submerged in water. And this has affected treatment regimen. It has also probably, predisposing even that particular place to waterborne diseases.
Well, I think we may have to stop. We may have to stop.
Yeah, I'm rounding up 1 minute, please, sir,
right,
so that I can request a question.
Okay,
thank you.
All right.
Infrastructure limitations. Participants pointed out that many healthcare facilities are structurally unprepared for extreme climate events. Many of our healthcare facilities in Nigeria are indeed structurally unprepared for extreme climate events, and then there is training and capacity gaps. So our study also found that there is resistance to change due to cultural, institutional, and bureaucratic factors, with some stakeholders potentially prioritizing immediate healthcare needs over long-term DRR planning. In conclusion, our study conducted interview on FGDs, and the outcome now, provide a nuanced understanding of the barriers, needs, and potential strategies for enhancing climate resilience in Nigeria healthcare system.
All right, madam,
serving as vulnerable input for policy recommendation.
Madam. Yes.
These are our recommendations.
Madam, hold on, madam. Madam,
yes.
Hold on. Listen to me. We are going to have discussions now, and then when questions arise, then you can bring in your recommendations, because we have just 10 minutes more. All right, please stay online, because some questions will be ready to you. Ladies and gentlemen, I want to open up the floor for discussion. Before we do that, I just want us to recognize the need why this side event is taking place. We don't need to repeat ourselves again to the fact that the developing countries suffer more from the devastating effects from the global carbon emission, and our health facilities are far, far below what is expected of of a standard healthcare facilities. Beyond this is the fact that the facilities are not even strong enough for any resilience, and which is why the WHO is also promoting resilience and safe hospital facilities. So what are we here for? We're trying to look, noise across the borders interest is one, to see how we can develop the capacity of the healthcare providers. Two is to see how we can also improve upon the healthcare facilities. Because number one, if those of us who provide the care to the people who are affected by the disasters are not well equipped with what is needed and the facilities are not there, then the disaster come and all of us will be targets of disasters. So we are welcoming partnership in terms of expertise, in terms of funding. So that is why this year we signed an MOU with the Federal Ministry of Health on this very goal, so that we're able to reach out using our connection everywhere to bring expertise to Nigeria to help develop and improve upon our healthcare facilities. And so, ladies and gentlemen, I leave the floor open for discussions, questions, and comments. We have just 5 minutes to do this. So if you have anything to say, just raise up your hands and tell us your name and your organizations. Thank you very much. Let me have this. Can I have one? If you have any comments. All right. Any comments? No contributions? If that means we are okay with the teaching. If you are in a class and the teacher teaches you and you have no question, that means the teaching is very good. All right. Okay then. Maybe I'll just give Professor Khadija 2 minutes to conclude our paper. Can you just give us your conclusion, please? 2 minutes.
Thank you very much. Our study concluded that there is need to collaborate with NGOs and international organizations. Is one of the recommendations. Anyway, the conclusion is that based on the outcome of our study, Nigeria needs to do a lot, and then to ensure that the facilities we put on ground have resistance for climate, especially with this current disaster that has been reported in a lot of northern facilities in Nigeria. Recommendations, the policy is there. We only need to advocate for more, and then such that there's going to be formation of task force or committee to drive the DRR reforms in the healthcare sector. Again, we recommended collaborating with NGOs and international organizations. Based on the outcome of the study, there's need to partner with non-profits and global health agencies to access technical experts. And I'm happy that Pastor is doing this with other global partners. There's need to grow public and government awareness the more on climate impact, potentially paving the way for future policy reforms and increased funding for DRR. Specific DRR strategies. We also recommended that based on the outcome of our study, our participants propose actionable steps such as creating evacuation plans, establishing early warning systems in healthcare facilities, or developing emergency communication networks. And then presence of international partnership and support programs such as those by WHO and UNDRR, which could offer guidance, training, or funding for DRR in Nigeria. And again, there must be willingness among healthcare leaders to integrate DRR into their health system.
All right, madam, thank you very much. Thank you very much. That is all we can take. We appreciate you. We want to draw our program to a close in the next 5 minutes. And to do that, we're going to have a vote of thanks, and then we're going to have a closing remark. And to give us the vote of thanks, let me call on Mrs. Helen Osawaru, who is a member of the Board of Trustees, to please come to the podium and give the vote of thanks for this event. Madam.
Thank you. On behalf of the board of trustees and members of our organization, Noise Across the Borders International, I have the singular honor and privilege to express our profound appreciation to all our esteemed speakers and attendees at today's event. Without you, this event would have been a disaster. Your interventions and contributions on the theme of today's event will in no small measure help us and other stakeholders in developing appropriate roadmap for action in mainstreaming climate change disaster risk into our healthcare delivery system. May I call upon both national and international funding agencies to support the efforts of nurses across the borders in this campaign. To the press, you are equal partners and stakeholders as you help to not only promote all actions and inactions, but also act as checks in all. We are grateful for your coverage today. I cannot end this vote of thanks without the special mention of the support and encouragement given to our president by Faculty of Health and Social Care, Department of Nursing at the University of Hertfordshire, United Kingdom, without which Pastor Peter Omoragbon would have been absent for this important activity. We remain grateful. Once again, I say a big thank you to everyone for honoring our invitation. God bless you, and see you again in COP30 in Brazil next year. Thank you.
So can we have the Deputy President of Noise Across the Borders, Honorable Adetola, to give his closing remark, please?
Thank you. As we come to the close of today's event, I want to take a moment to express my sincere gratitude to everyone who has contributed to making this gathering a success. To our esteemed speakers, thank you for sharing your insights and inspiring us with your expertise. To the organizer, your handwork and dedication behind the scenes have not gone unnoticed. And to our amazing attendees, your presence and active participation have truly made this event meaningful. Today, we have explored ideas, exchanged perspectives, and set the stage for meaningful progress. Let us carry forward the momentum from this event, striving to implement the ideas we have discussed and to build stronger connections with one another. As we look ahead to future opportunities, including forthcoming COP30, let us remain united in our commitment to growth, innovation, and collaboration. Thank you all once again for being here. Until we meet again, stay inspired and stay connected. Thank you.
All right, ladies and gentlemen, I want to thank you all. All the speakers, please, can we all have a stand here for a group photograph? Everybody, please. Thank you very much.